So, hello, welcome back to Pen and Paper. Today we are going to talk about the topic sex ratio. This is one of the most important topics from community medicine, but this is a very simple topic. We will try to cover this topic within 10 minutes. This topic is asked as an SAQ in university exams. First, let us talk about the definition. Sex ratio is the number of females per 1000 males in a given population at a specified time. Then factors affecting sex ratio. First, sex ratio at birth. Naturally, slightly more male babies are born than female babies. Any further fall in females indicates social and cultural influence. So at birth, male babies are born more than the female babies. Second, female feticide and infanticide. Preference for a male child leads to misuse of prenatal diagnostic techniques and killing of female fetus or newborn. This is the second factor, female feticide and infanticide. Third factor, differential mortality. Female children and women suffer higher death threats due to neglect, poor nutrition and delayed treatment. The girl child usually suffers more neglect than the boy child. Early marriage and early pregnancy. Early childbearing increases maternal mortality and reduces female survival, hence affecting the sex ratio. Then, poor nutrition of girls and women. Girls receive less food and care compared to boys, leading to ill health and higher mortality. So the third point and fifth point is directly connected. Sixth, low status of women in society. Limited education, lack of decision-making power and dependence on males adversely affects survival and well-being of females. Okay. Seventh factor is migration. Large-scale male migration for work can alter the sex ratio of a particular area. Eighth, socio-culture practices. Dowry system, son preference and discrimination against girl child reduces the value of females in society. Now you can draw an illustration like this in the exam to explain the factors affecting sex ratio, such as fertility factors, mortality factors, migration, sex selective deliveries and medical terminations, differential nutrition, differential mortality. Also, due to cultural, economic and social factors, there is son preference and low fertility. Now, the catalytic factors such as access to ultrasound or abortion and population policy or small family norm, there is sex selective abortion which affects the sex ratio. Now let us talk about the sex ratio in India. During 1901 it was 972 to 1000. During 2001 it was 933 females to 1000 males. During 2011 it was 940 to 1000 males. Haryana has the lowest sex ratio of 877 female per 1000 males. Kerala 1084 to 1000 and Puducherry 1038 to 1000 are only two places in India where total female population is more than the male population. Only two places, Kerala and Puducherry. So sex ratio of India varies from region to region. Other states like Andhra Pradesh, Maharashtra and Karnataka are also showing an increase in their sex ratio. Now what are the measures to improve the sex ratio? First, strict implementation of laws, effective enforcement of laws banning sex determination and female feticide, that is PCPNDT Act. So we have to effectively implement this act. Second, promoting female education. What will that do? Education improves awareness, self-confidence and social status of women. Third, improving status of women. economic independence, equal employment opportunities and participation in decision making. Fourth, public awareness and behavior change, mass media campaigns to discourage son preference and promote the value of the girl child. 5. Delay in age at marriage and first pregnancy, reduces maternal mortality and improves female survival. 6th, improve maternal and child health services, better antenatal delivery and postnatal care for women and girls. 7. Nutrition and health support for girls, special nutrition and school-based health programs for adolescent girls. 8. Social support schemes for girl child, incentive schemes for education and welfare of girls and their families. Sex ratio is a sensitive indicator of the social and health status of women. Improvement in sex ratio requires legal, social, educational and health sector measures together. Also, you can write these legal frameworks in the exams. PCPNDT, Preconception and Prenatal Diagnostic Techniques Act. It prohibits sex selection before or after conception. Then there is MTP Act, Medical Termination of Pregnancy Act. Then there is Hindu Succession Amendment Act, which gives daughters equal rights in ancestral property. Then there is social and welfare schemes such as Beti Bachao Beti Padhao Yojana and Sukanya Samruddhi Yojana, in which a small deposit is put in the account of the girl child. And then there is Janani Suraksha Yojana, which focuses on maternal health and incentivizes institutional deliveries. So that was all about the topic sex ratio. Subscribe to our YouTube channel for more exam-oriented videos related to important topics covering MBBS. Join our Telegram channel for notes and Instagram page for must-remember exam points, mnemonics and previous year MCQs. We will talk about another topic in the next video. Thank you.